Good afternoon, everyone. It is my honor to welcome you to the April Interdisciplinary Education Grand Rounds. I'm Margaret Robinson, the Senior Associate Director for the Office of Interdisciplinary Programs. The Office of Interdisciplinary Programs is housed in the Office of the Vice Provost for Academic Affairs and Faculty Development. Our office is charged with the development, implementation, operation, and evaluation of our campus-wide interdisciplinary and interprofessional education requirements. Today, we'll refer to this as IPE, the acronym for Interprofessional Education. We'll begin shortly, but a few housekeeping items. Today's presentation is being recorded. We will upload the recording to the IPE website. Please remember to use your mute for your microphones and use the chat function during the presentation. We will all be monitoring it, and you can use the chat as often as needed. I will be your Zoom facilitator today, and you can message me directly with any technical issues. I will put my cell phone number in the chat as well. I will also advance our slides here to the attendance and evaluation items from current slide. That way you can use your phone for the QR code for attendance, and I will put a link in the chat as well. And then if you need anything else during the meeting, please let us know. So without any further ado, I will turn this over to our Interdisciplinary Student Council.
Well, thank you very much, Margaret. Appreciate that and all your housekeeping assistance with us. Welcome everybody to the April Interdisciplinary Grand Rounds. My name is Ozair Nukvi. I'm one of the Interdisciplinary Student Council liaisons, and I was charged with organizing this April Grand Rounds. And I appreciate everyone's flexibility, especially our guest speakers, for some scheduling changes we had to make, but we were determined to make this happen. This is a very timely and important topic. I was mentioning to the panelists earlier that I was actually watching the BBC this morning, and there were continued reports about the impact of climate change on our planet and just how much of an important issue this is. And I thought this would be a great Grand Rounds to host this semester, to go off of our Bridges to Access fantastic conference we had last year, analyzing the impact of climate change on health. And so our focus today will be looking at the impact of climate change on health and medicine, healthcare, and all those important factors that impact human health of our communities. As I mentioned, very timely and important topic. And we are welcomed by some great panelists who will give an overview of their perspectives on this topic and provide their expertise. And then we'll enter a kind of a panelist discussion with questions from the audience at the end. And we will start with our own Dr. Kathrin Kuhn. Dr. Kuhn has more than 20 years of experience in infectious disease epidemiology with a focus on surveillance and One Health, including climate and environmental changes. Dr. Kuhn is one of the original initiators of the Center on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine, where she completed her master's and PhD degrees and also worked for several years. Following this, she worked for 14 years as a senior epidemiologist at the National Danish Institute of Infectious Diseases and transitioned to the University of Oklahoma Health Sciences Center in 2020, where she is now a part of our department and leads in Department of Epidemiology and Biostatistics, where I'm also a student. So, just some favoritism there. She's a fantastic professor, great addition to our department. And where she now leads epidemiologic and analytic work on Oklahoma wastewater surveillance, including predictive modeling and outbreak analytics. In addition to her work in the US, she's also an external professor in clinical trials and education at the London School of Hygiene and Tropical Medicine, and just a fantastic expert in climate change and impact on public health. And we're grateful for her time to be able to share her expertise. And so without further ado, Dr. Kuhn, I'll let you share your screen and we can get started.
Thank you, Ozair, for this very humbling and amazing introduction. And thank you, Nolise, for also inviting me to present here. As probably you have all guessed, I'm a big fan of research and climate changes, and I've been doing this for many years. So it's a thorough pleasure for me that it's becoming more and more accepted, doing research in this topic, and that we're kind of more or less all on the same page, those of us working in infectious diseases now. So in my talk today, I'm going to talk a little bit about the overview of climate changes and human health in relation to infectious diseases. Then I will have a little brief discussion primarily with myself on what is the best way of monitoring how these changes can appear in populations. And finally, I'm going to sort of give an overview of why does climate change matter for us working in public health, and what is our role, and what can we do to provide knowledge to populations about this. First of all, I'm going to say, unless you've been hiding under a rock for about 10 to 15 years, it shouldn't come as a surprise that the climate is changing. In some areas, might be for the better, but it's our impression that most of it will be for the worst. And this is not just for infectious diseases, it's for everything ranging from heat stress to crops, really animal populations, everything that we can think of really has will be impacted by climate changes. With respect to infectious diseases, we know that some of the largest disease burdens are very sensitive to climate. We look at diarrheal diseases that are caused by viruses or bacteria. Around 2 million people die from diarrhea every year. We have millions of children that die from undernutrition because of lack of food, access to sanitation and hygiene. Not least, one of the real big actors in infectious diseases is malaria, and around 100 million people die from malaria every year still. And on the other end of the spectrum, we have direct extreme weather, which unfortunately some of us experienced yesterday in Oklahoma. And I feel like this is becoming a more and more common occurrence. So we might be seeing already some effects of climate changes here. One of my good old collaborators, John Patz, wrote a paper in 2005 where he estimated that since the 1970s, approximately 150,000 people each year are dying directly because of climate changes. So it's a really big scale we're talking about here, some massive effects throughout the globe. As with all things related to public health and infectious diseases in general, these effects are not evenly distributed. So what we see here in this map is on the top, we have the countries or the regions of the world who are the biggest drivers of climate change. And then we have on the bottom, the regions and countries that are predicted to suffer the worst. So it's it's an uneven distribution. The ones who drive the changes are also the ones who will suffer the least from the consequences in the end. I'm going to talk a little bit about some diseases now that have been pets of mine and which I think are really good examples of sensitive diseases with respect to climate, and also something that we should be looking out for at the minute. The first one is West Nile virus. It's a virus that's transmitted by mosquitoes. And I say it's the boring brown mosquito that's also called Culex, if you're an entomologist. It's the one that you'll be swatting around the most here in the summer. It's just boring. It's brown. There's millions of them and common everywhere. West Nile virus is mainly in birds. So birds are the main reservoirs. And when it's transmitted to mammals, such as humans, it's a dead end. So that means we cannot, as humans or the other mammals that it infects, transmit the virus onto others, which is a good thing because it kind of limits the potential for this disease to cause massive outbreaks. West Nile first circulated in Africa. As we all know, birds migrate, and even infected birds with West Nile virus, they also migrate. So it's believed that infected birds from Africa have been migrating across the world, and that might have led to the first case of West Nile virus that was reported in New York in 1999. And then it just really spread, I won't say like wildfire, but it spread tremendously across the US and also in parts of Europe and in Australia. So today, there are reports of severe outbreaks from time to time. We have what entomologists and infectious disease nerds like me will call West Nile years. And I know that we are due for one in Oklahoma. So it might be this year, it might be coming up next year, but for certain it's coming very soon. West Nile virus is very strongly linked to climate because birds and mosquitoes, they follow the weather. Mosquitoes like to breed where it's wet, we all know that. And birds, well, yes, as I mentioned before, they migrate to places where the climate is suitable for them. We know also that many locations in the US are becoming more suitable for West Nile virus transmission. And I'm showing a map here that's made by the CDC, where we see an increased probability in actually most of the US, if you look at this. So this is a probability of West Nile virus being transmitted by 2050 or 2080 in the dark red here. Really, it's not looking good for Oklahoma in general. There are some areas here in some locations where there is a decreased probability, but overall, the probability of West Nile virus becoming more and more established in the US and potentially causing even more severe epidemics is really increased throughout most of the country. The second vector-borne disease that I will cover is Chikungunya. It's also a virus with a little bit of a complicated name. And this is transmitted by the Aedes mosquito, which is also called the tiger mosquito. And if you look at them very closely, you can actually see it with the naked eye. If you have a tiger mosquito nearby, it's very distinct markings. It's white and black, white stripes. They're not very big, but you can still see them. And I just think they're really cool. For chikungunya, humans are the main hosts and reservoirs. So there are not really very many other animals involved, unlike West Nile virus. Before 2013, there were some outbreaks in Africa, Asia, and Europe, but then suddenly the virus spread through the Americas, from the Caribbean, and now it's really prevalent in most of the US. I would say it's not as big a problem at the minute as West Nile virus, but the main impression is that it will become an increasing problem in the US because the mosquito is spreading at quite a rapid rate. On these two maps, you can see the current or previous transmission of chikungunya. So again, some selected areas, not so many in Europe. The US, we have a little bit of transmission going on there. But what is really interesting is the suitability map that you can see here at the bottom, where Aedes aegypti, the tiger mosquito, where its present day suitability, it doesn't mean it's present at this time, but it means that the climate is suitable for it. And then we have the future suitability in the red lines here, so you can see there's a prediction of the mosquito actually moving northwards. And if there are people carrying chikungunya virus and mosquitoes nearby, we know that there is a potential for establishing local transmission. Other diseases that I think are really relevant to think of also is tick-borne diseases. You've all heard about Lyme disease, probably. We know from work that I did with some colleagues in Scandinavia that ticks are extremely fussy with climate and vegetation. And if it changes just a little bit around the corner, well, they're going to move there as well with all the lovely diseases that they carry. And one of them is Lyme disease. I think this is a really good example. These two maps here, you can see in 1996, the distribution of Lyme disease in the northern part of the US. I'm not well versed enough in the geography, sorry to tell you which states they are, but it's very north. You can see a massive spread of Lyme disease in so about 20 years' time, it has really spread tremendously throughout this region. And these are confirmed cases, so a lot of spread here. Another one that is a personal favorite of mine are gastrointestinal pathogens like Salmonella, Campylobacter, Shigella. They are very sensitive to climate. Also, we usually don't think about them, but throughout my work, I've discovered that the outbreaks are often associated with extreme rain. And this is because, whether we like it or not, rain makes everything flood. And if things flood, the flood water tends to carry poop, be it from animals or humans all around. So when you're in contact with flood water after a lot of rain, there is a very increased likelihood that you are in some way in touch with poop coming from humans or animals that carry some of these gastrointestinal pathogens. This picture here is a classic one from Copenhagen. There was a flood, I think it was in 2011, and I worked on this because there was an outbreak of Campylobacter after this flood. And we couldn't really understand why it happened because there wasn't anything really connecting the cases. And then we found out that several of the people had actually been swimming in the flood water. So this is a street that is flooded by rainwater after this heavy rain. It's flooded with sewage. And these people thought it would be really nice to take a dive into the sewage here. So just a word of advice, please don't do that in the nearby future. Yeah, now I'm talking a lot about theories about what diseases are going to emerge, where they will go, and what to look out for. How do we actually go about determining whether these increases are really happening? Well, the first thing for me is to think about One Health. One Health acknowledges the fact that human health is connected to the health of animals and the environment. And we really need to work across disciplines because we cannot just isolate human diseases in a bubble by themselves. Most human diseases are coming from animals in some way or the other. And we know that if there are changes in climate, then there will be changes in animals and the ecosystem. This could be changes in the ranges of animals, where they like to live, where they like to forage, could be biological activity, they could be more active throughout longer periods of the day. There could just be more of them because the climate is better for them. Some species could be lost and replaced by other species, which are more likely to transmit some diseases. And there could also be an entire switch of ecosystem types, which means that new animals would invade areas where they are previously not present. And what does this mean to human health and disease? Well, it means that we are looking into a future where we are more likely to be exposed to certain diseases that might not even be here yet. We know, and this has been confirmed during COVID again and again by experts, that around 80% of new emerging diseases that we've never heard of before actually come from animals. So they're zoonotic, which is why it's really important to keep the One Health in mind all the time. And also to make everybody really scared about the next pandemic, it's been estimated that around 800,000 unidentified viruses exist out there in the environment that have zoonotic potential. That means they have the potential to be transmitted from animals to humans and then establish their own transmission system within the humans. So what is the surveillance issue? Well, I worked with surveillance for many years, and I know that surveillance is very tricky because we only tend to see the things that we're actually looking for. With surveillance in respect to climate changes, we want to find a way of capturing the population that's at risk of climate changes. This could be certain rural areas. We know many of them are vulnerable to climate changes. We know also they are underserved with respect to healthcare, with respect to prevention and ultimately treatment. So these are really areas that we need to focus on. On top of that, we also need to find systems that are able to capture changes in animal or vector populations. We need to find out where the animals and the vectors are, and then we need to be able to monitor them routinely over periods of time to see whether changes are occurring. And this is really hard. When we look at monitoring in humans, well, we have a lot of artifacts going on with the surveillance as it is now. When you have an increased focus on disease, you might see increased testing, and then you'll think, oh gosh, there's many new cases, there's an outbreak happening. But it might actually just be how it really is, but more people are seeking medical attention, and the medical attention is being focused on this disease, so you have more cases diagnosed. This is what we saw probably also during COVID, but there was a lot of focus on this particular disease, a lot of cases reported, and some diseases were not reported so much, and people were likely to think, okay, we didn't have a lot of influenza happening, but maybe it was just really there, but people weren't being tested for it. So how are the solutions for surveillance? Well, I'm not going to tell you I have them all. I have some thoughts about it. Primarily that they need to be cheap, they need to be easy to set up, and they need to obviously cover the communities and the vulnerable populations that I talked about before. They also need to be representative of the disease and the population that we're monitoring. And ideally, we would like them to be able to stand as a complement, or dare I say it, as a standalone to traditional surveillance. So the passive surveillance that we have now, that I mentioned before, is working, but then on the other hand, it's not working for many, many reasons. So we really need to ramp it up in some way so that we are better prepared for any future pandemics that might happen as a result of climate changes. There are many ways of doing novel surveillance. One thing that I think is really cool, and it's something that we all use every day, is Google. When people are sick for some particular reason, they go on Google and they Google, oh dear, I have a sore throat and my cheeks are flushed. What could this disease be? So what you can do, you can actually set up syndromic surveillance through something called Google Trends and see if there are any peaks in the symptoms that people are Googling on any specific day. There have been several outbreaks detected through this alone, some in New York and also a couple in Europe. And if you're interested in this, I would advise you to just Google it and see what it comes up with, because this is a fantastic new surveillance method. Another one, which is probably not a surprise to any of you that I talk about, is wastewater surveillance. This is basically where you go out, you test the wastewater, and then you see what pathogens are lurking there, and you monitor the prevalence or the concentration of these pathogens over time. This is really good because you get early warning. When we go to the toilet and we excrete whatever pathogen we're carrying, we get an immediate image of what a person is carrying around by analyzing the samples. We don't have to wait several weeks for the person to become ill and go to the doctor and have their sample taken and have the final diagnosis. This is from day to day, we can see what people are infected with in the wastewater. We cannot obviously either identify any individuals. So really, if somebody's feeling sick, they still have to go to the doctor, but we can see trends in the community. And more importantly, we can see trends in the communities where we need the most information in order to help vulnerable populations. Okay, the last little bit I'm going to talk about is climate change in public health. How do we kind of reset ourselves to talking about climate change and kind of acknowledging that it's going to be part of the future? Well, why do we even care? We care because it's going to affect us and the people around us, whether we like it or not. There will be emerging diseases in local areas. We've seen that during the past few years. We will see travelers coming back with new diseases from certain locations. And as I mentioned in one of my initial slides, it's also a social justice issue because the health impacts will be really unfairly distributed. So the populations and communities that can least afford it really are the ones that will be impacted the most. And obviously that is where a lot of resources will have to be distributed. And I would say also finally, as public health professionals and medical professionals, we have the skills and we have the voice to facilitate and support any measures to adapt to the effects of climate change. We can do research, we can do surveillance, but certainly we can also contribute to new policies being made, whether that is to kind of reduce what is driving the climate changes, or even facilitate better finances for public health in general. And finally, we can also, and I think this is one of the biggest ones, we have the voice to give advice to the people. We can talk to them about things that they need to be aware of in relation to climate, but also just looking after yourself and looking after your own health in a new changed environment. Finally, I think this is a fun slide that I just want to show because we've all done this over the past few years. Nobody fights alone, nobody fights a pandemic, and nobody fights a disease alone. So we're all in this for a better cause. And I think collaboration across centers, across disciplines, and certainly across people and with your hands, washing, hygiene is something that's really important. And we all need to be aware of that. And with that, I have finished, and I want to say thank you for your attention and take any questions, or I think they'll be at the end. Okay, yeah. Thank you very much.
Thank you, Dr. Kuhn. Appreciate that. Yeah, we would be holding questions for the end for all the panelists, kind of more of in a panel format, for sure. But I definitely know I'll have a few questions myself too. Very informative presentation. Very much appreciate that. So next, we're going to pan over to Alice Moon and Joy Sue, who will be co-talking to us together from their experiences related to this topic. So Alice is a third-year medical student at the University of Oklahoma College of Medicine who received undergraduate education in letters and linguistics and has a specific interest in primary care and community-based medicine. During her education, she has served as the Bridges to Access Conference Chair and the co-president of Environmental and Sustainable Health. to promote medical education on the health effects of climate change. Her work regarding health education on climate change and social determinants of health has been published in the Journal of Climate Change and Health and the Journal of the Oklahoma State Medical Association, respectively. And the culmination of her experiences has taught her to prioritize compassion, creativity, and open dialogue within healthcare and community relationships. And she plans on pursuing a career in primary care. So Joy, who will be kind of tag teaming this with her, Joyce, who is a third-year medical student also at the University of Oklahoma College of Medicine, and she grew up in Eden, Oklahoma, as daughter of a first-generation immigrants. After graduating from Grinnell College with a bachelor's in biological chemistry, she served as an AmeriCorps volunteer and teacher in the South Side of Chicago. She is passionate about advocating for minoritized and underserved communities. And during her time in medical school, she has served as the Bridges to Access Speakers Committee lead and as executive lead of Oklahoma's first ever Asian Pacific American Medical Student Association chapter. She hopes to pursue a career in neurology. And in her free time, she loves to bake sourdough bread, tasty, play video games, also support that, and relax with her cat, which I also appreciate greatly. So without further ado, I will turn it over to you both after, and I just want to say their work with Bridges to Access last year was just fantastic, and I personally was able to attend some of their seminars and presentations, and it was just such a well put together event and such an important topic. So just appreciate both of their efforts and advocacy in this area.
Well, hello, everyone. Ozair, thank you so much for the introduction, and thank you all for being here. And happy Earth Day as well, which will be in 2 days. So Joy and I are super excited to jump in and basically share our medical student perspective on climate change and health. We're going to be talking about some of our takeaways from the conference that we held, and then kind of diving in on why we focus on climate change as well. We also are happy to answer any other questions, and we'll be happy to talk with you all. So to get started, we chose health and climate as the focus of our conference, which was held in February of last year. And why did we choose this as our topic? So firstly, you should have some background information about Bridges to Access. It's been on our campus for 16 years. And its long-term goal is to address the most pressing health issues of our time and to inspire solutions for students. The audience is for health professional students, and we also have a focus on issues that affect underserved communities. So we chose climate change because it is the most pressing issue of the 21st century, according to the World Health Organization, according to scientific bodies and medical bodies. And it's a global public health crisis. It's also an everything issue, so it's affecting our health, but it has effects that go throughout the entire society, really, on economics, where people live, what jobs they can do, how resilient they are, and then their health and their children's health. So around the time of the conference, The Lancet published an editorial right as we were planning the conference, and its editorial was urging world leaders to act on climate change. They declared that the greatest threat to global public health is the continued failure of world leaders to keep the global temperature rise below 1.5 degrees Celsius and to restore nature. Urgent society-wide changes must be made and will lead to a fairer and healthier world. So this editorial was the joint effort of more than 200 medical journals, and we recognize that the medical community as well knows that this is an issue, but many students, or it takes a while for things to trickle down into curriculum, so many students might not actually understand what the health effects of climate change are. So that was kind of one of the focuses of our conference, talking about the health effects of climate change. Due to the forces like increased sea level rise, rising temperatures, increased carbon, and then more extreme weather events, you end up seeing effects on nearly every organ system of the human body. So this gives some examples of that, where heat-related illness and extreme weather effects. I saw a figure that said that over the past 20 years, heat-related mortality among people older than 65 has increased by more than 50%. Then things like heart health, lung health, where you have people who are coming to the ER more often, are having more COPD or asthma exacerbations or congestive heart failure exacerbations, and using the hospital resources more. As Dr. Kuhn discussed, and she was actually a part of our conference and discussed infectious disease as well. Changing vectors impact where infectious disease is and who's susceptible. And then globally, the issue of water quality and malnutrition is huge, where if you have crop failures due to increased heat, then you have people who aren't able to get all the nutrients that they need, or not even enough food for what they need. And then there are more macro level effects as well, like changing where people can live, forcing people to move, and then conflicts that result in different societies due to these stressors and poverty and all of these things. Mental health impacts due to things like anxiety or trauma related to seeing extreme weather events. And then all of these things, as Dr. Kuhn alluded to, affect people differently, and certain people will bear the brunt of these effects. So people who don't have lower resources, have lower healthcare involvement, who are minoritized, who are women, children, elderly people, or people who already have chronic illness, these are the people who may also bear a lot of the impact. And for me, part of what really stuck out about this topic, health and climate, is that definitely as we were planning the conference, it seemed like most of the focus was not on the health aspect of climate change. And so it didn't seem like it was commonly considered. And certainly when we were planning this, a lot of my classmates would come up to me and say, I hadn't really even considered this, or I hadn't really thought much about this, and I didn't really know what all was kind of contributing together. However, research shows that when we do frame it as a health issue, people are more concerned, more likely to act. And that goes for, the public, but also representatives and everyone we want to communicate with. So health is really the human face of climate change. And then we had noticed that despite the negative impact on health, our medical curriculum did not cover these things. And actually, that's not just here, but that's nationally, where there's not much information provided to people. When you look at national surveys as well, medical students, very few of them feel that they've been educated on these topics, or that they're prepared to address them in their practice later on. So that all is kind of why we covered this as a topic, and why we're really passionate about it and wanted to share this with our fellow students. I had mentioned the 2021 Lancet article, which was published around the time that we were planning. And so I wanted to kind of zoom back and ask, where are we now? And these next couple slides are pulled from the Intergovernmental Panel on Climate Change, the IPCC, their recent synthesis report released in March. It integrates the findings of the past several reports that they've done over the past 8 years or so. And the point of sharing this is kind of to share some high yield points of where we know we are. There are a lot of graphics, and so it's also to encourage you to go look at it on your own in more detail at a later point in time if you want. So firstly, we know that climate change has already caused widespread and substantial losses to almost every aspect of human life on this planet. And that's kind of demonstrated in this left slide, where you see the losses that are related to water availability, food, health, biodiversity, etc. And then secondly, the impacts on future generations depend on the choices we make right now. This is shown in the right graphic, where you can kind of see the different outcomes depending on the choices we make at this time. Then we know that every bit of warming matters. So the warmer the planet gets, the more widespread and pronounced the changes become to both average temperature as well as extremes in temperature. And you see the different outcomes of how much warming there is and the trickle-down effects. Then thirdly, the impacts are very serious and directly affect our health, our food, and our water. And unfortunately, we haven't done enough yet to this point to avoid the dangerous impacts. So you can see where our projection is and where other projections would have us and what types of actions would need to occur to limit warming to those degrees. But then finally, we're at a critical point in time where our choices matter. And the earlier we act, the faster we act, the better off we will be. So I love this diagram because it shows that here we are at this point in time, and as we make choices, those will determine the options later on and the ultimate outcomes for us. And it also points out things that enable these actions and then things that kind of prevent and are barriers to being able to act on climate change. All of this is pulled from the IPCC, and then Kathrin, who's a climate scientist and communicator, she was the person where I actually saw these first, and she kind of provided, a way to think about these graphics. So with that, I would like to pass it off to Joy, who will focus in on bridges to access.
Thank you, Alice, and thank you everyone for being here today. So if we can go to the next slide, yes. So this slide is really a complete overview of our conference programming. We had 3 keynote speakers listed over on the left. Dr. Haley, who talked about the science of climate change, Dr. Kraft, who talked about the Climate Vulnerability Index, and Dr. Doggett, who was really discussing how to be an advocate. And we also had 14 breakout session speakers. And our goal with this was to really utilize Bridges to Access as a way to bridge the gap in knowledge and education for our students. So our goal was to address the lack of education on climate health impacts. And we had several speakers talking about the health effects of climate change, including Dr. Kuhn, who discussed infectious disease. And we had speakers discuss air and water pollution, occupational exposures, mental health, and these impacts of climate change. We had several speakers talk about climate justice. So Dr. Rudolph, who is a national leader, actually discussed climate change and the inequities. We had speakers discussing gentrification and cancer, and many of our speakers touched on climate justice in their talks, even if it wasn't in the forefront of their discussions. We tried to include local aspects to Oklahoma as well. So we actually had Maureen Heffernan. She is the CEO and president of Scissortail Park Foundation, and she talked about sustainable community development. We had Maxton Harris, who is a city planner with Oklahoma City, who has helped in sustainable community development, and he was involved in the bike pathways and the projects going around in Oklahoma City. And we also had the president of the Oklahoma Solar Association, so Lindsay Peaver, addressing causative factors of climate change and potential solutions in our state. And if we could go to the next slide. So some keys from our keynote speakers. Our conference was split up into 2 days, and we had Dr. Haley give the first keynote talk about the science of climate change. And his talk was really to show our students the scientific evidence behind climate change and how it is threatening the world, and it is something that has been caused by humans and the carbon emissions that we've created. On the next day, we had our second keynote speaker, Dr. Kraft, who has done a lot of advocacy work in climate health advocacy and inequity, and she was providing personal insights on her battle with policy changes and solutions and her research into this tool called the Climate Vulnerability Index. And our final keynote speaker, Dr. Doggett, who's amazing, gave a really wonderful talk about ending on a more positive note about encouraging our conference attendees to act as community leaders, because inherently, if we're in this Zoom call or if they were attending Bridges to Access, they have the ability to be really great community leaders and advocates, and many people will look to them for advice. And I also just really think that Alice herself is living this. She is an advocate and she does this every day. So I'm excited to see where she goes in the world in the future too, with the future and where we go. So if we can go to the next slide. This is now just to address the effectiveness of Bridges to Access and the conference. We had pre and post survey questions for our attendees, and we had 350 attendees total from 6 out of 7 of the colleges located on our campus, and we had 177 student respondents. This is a sampling of some of the survey questions that we had. You can see from these questions that our conference really increased understanding about climate-related health effects. So question 1, to what extent do you understand the broad climate-related health effects? Question 2, would you be able to teach someone else? Questions like these, our students really increased their understanding. Some notable decreases that we had were actually question 15. So to what extent do you feel prepared to address the health effects of climate change as a healthcare professional? So people actually came into the conference with a score of about 3.05, and they left with a lower score because they understand that this topic is very nuanced and complicated, and maybe they overestimated their understanding before coming into the conference and being educated. The same with question 18. So pre-conference, to what extent do you feel your institution's curriculum has adequately taught you about the broad health effects of climate change? With this question, students actually came in with a score of 3.1 and left with 2.41. So as people were educated on the topic, they realized how much understanding they really lacked because of how much they had not been taught about these topics. But yes, we can go to the next slide. So these are some of our takeaways from the survey results and the conference as a whole. So our results really indicated that Bridges to Access was an effective model for educating students, and it also helped increase self-efficacy and climate-positive beliefs about the topics of climate and health. Our students walked away with a better understanding of the broad and specific health effects, and it also gave them more confidence in their knowledge and ability to educate other students and potential patients in the future as well. Our attendees from the 6 out of 7 colleges and from various health backgrounds, we even had high school students and undergraduate students from OU attend. And it was a very interdisciplinary discussion where we supported collaboration and shared values, and we exposed everyone to additional viewpoints for discussion. Yes, and I'll let Alice take it away with our conclusions.
Yeah, so this was our perspective hosting a conference, kind of creating a conversation on campus. We also found that, given that medical curriculum and different curriculum is very busy and filled with a lot of stuff, that if medical schools prioritize climate change curriculum, one way to educate students would be to incorporate it into their actual curriculum longitudinally. But if they feel like that there's too many constraints, then having something like Bridges to Access, so like a multi-day deep dive into these topics, would potentially effectively teach students about climate and health. And we were really happy to see that people left the conference with a lot more understanding and feelings of responsibility, and also super happy to, start the conversation on campus. There's hosting this interprofessional grand rounds is a great opportunity to continue it. And one of the most important things at this point is to talk about these issues and to really share our perspectives, especially as healthcare providers. Everyone, it's all hands on deck right now. And the more we can have conversations about this and encourage those conversations to lead to changes on the collective level, the better. So a couple of things that Ozair prompted us to maybe consider including in our talk was, where would we like to go from now, and what would we like to see on campus here? So I wanted to share just a couple of things of ideas of what I would love to see, and then Joy, if you want to jump in as well. So I'd love to see curricular changes where medical students see the connection between health effects and the increased risk related to climate change. I'd love to also see our school provide more information about how we're sourcing our energy, data related to that, and then see a climate action plan on the basis of our school. Many school emerging pattern is that schools are releasing their climate action plan, and ultimately we know that the future kind of depends on changing our relationship to fossil fuels and the way that we use energy. And I'd also love to see a climate change task force that is composed of faculty members, students, administration as well. Those are some ideas of things that I'd love to see happen, soon, really, so that we can best make changes at this present moment that will impact our future and ensure that we're in the best position in later years to act on climate change. Joy?
Yeah, I'd like to start off with a personal anecdote. So before I started medical school, I worked as an elementary school teacher on the south side of Chicago. My students were in an under-resourced, minoritized community, and I thought it was so odd that of my classroom of 30, actually 9 to 10 of my students had asthma. And so every day before they go outside, we get out the inhalers, and a third of the students would need to take albuterol inhalers. And I just thought that it was so odd. And when I actually started researching and looking into these things, I had this epiphany as we were planning this conference about how it's directly related to the fact that Chicago, like many other cities and communities, places the brunt of air pollution and waste facilities and communities of color in low-income communities. And we are seeing direct health impacts from that. Many of my students didn't want to go home after the after-school program because in the summer months in Chicago, it's too unbearable now to live without air conditioning, but many of the old apartment complexes don't have them. And it's directly impacting their health now. Something that I'd really like to see on campus is, while Bridges to Access is amazing and a wonderful resource to educate students on topics that aren't addressed in the curriculum, I would love to see an integrated curriculum. So students being educated through their entire medical education or whatever their education they're coming through the health sciences campus for them to understand at each step of the way, and integrating learning objectives related to climate change and climate-related health effects.
Thank you so much for
Thank
that.
you all.
Oh yeah, thank you both for that fantastic informative presentation and those lessons learned. And really, you kind of essentially kicked off the Q&A portion by answering that question. And so, because that was definitely a question I was going to play on asking to kind of kick it off anyways. That's kind of where we go from here and what you'd like to see us do on campus additionally to address this and keep the conversation moving. And so I appreciate you guys kind of just taking the first stab at that and kicking it off. And we're happy to open it up for questions from the audience for our panelists, or putting your question in the chat and the Q&A, and we can read it off and address those as well. While we wait for people maybe to think about the questions I'd like to ask, I would like to kick it over to Dr. Kuhn and also see if she had any perspective to add to what Alice and Joy just mentioned about where they like to see things go from here, not only on a campus level, maybe on a national and international level. My understanding is that you work with the World Health Organization on these topics as well. And so I just wanted to get your perspective on that issue.
Well, I completely agree with everything that Joy and Alice mentioned, that there is really a lack of focus on the effects of climate changes, especially within the medical community. So I think for us, it's a matter of getting people where they're at, trying to set up lessons and putting it as part of the curriculum, both for the public health students and also medical students, One Health and climate changes. There's a lot of topics. It doesn't have to be, just boring CO2 outlets and weird graphs showing this and that, but there is a lot of work to do. And for me, that is really the most important, is to get the students engaged, set up classes and make it part of the curriculum so that we can move forward with it.
Absolutely. You make very good points about that and the importance of integrating the curriculum. And then I think platforms like this, like Interdisciplinary Grand Rounds, is a great way to bring students and professionals together in an interdisciplinary forum to address those. We'll wait for other questions, and someone feel free to raise their hand if they have a question, or put it in the Q&A chat as well, and we'll read them off. Another thing that just came to my mind was just thinking about like the medical and the healthcare system. And I think back about at developing nations and different famines they have to deal with due to droughts and then flooding, and just the impact on just the medical system and then stressors on the medical system. So I didn't know if you could all just kind of maybe share your perspectives on some more of the vulnerabilities to our healthcare system that you see that would be adverse results of climate change, and not only just extreme weather patterns, but just the gradual changes over time, and then how that really impacts care that people can receive in the communities.
I'll just jump in for a little bit. I'm no expert, but I know that with the different hurricanes that have happened in the past couple of years, those are really good examples where the health system is not set up to be resilient in the face of some of those power outages, flooding, and issues that contribute to that. So like people not having enough normal saline, fluids, things like that, not having electricity in homes. So if you have people who are dependent on oxygen or dependent on refrigeration or anything, they're put in times of stress at that moment because they're no longer able to access their oxygen. They're also vulnerable already physically to the ongoing threat. And with the refrigeration, for example, then their medicines may be spoiled, and then they'll miss necessary doses. So those are some examples I think of, but I think you can probably look beyond the United States to see where else health systems really encounter a lot of stress and are affected, and ultimately have to. I know one example is, I think in India presently, schools are having to close due to the heat. And so that's another type of example where you can't have people going outdoors because of these things. But that's my perspective. Yeah.
I think, again, also it's a question of educating not only the medical professionals, but the public about what diseases could be out there. I think we know for many of the infectious diseases that I was talking about, the initial symptoms are like the flu. So you could go around for 2 weeks thinking you have the flu, but you might actually have Lyme disease, you might have West Nile virus, you might have Chikungunya. And if you're lucky, the symptoms will disappear and you'll be well. But a certain proportion of people, they become very, very ill. And those are the ones we need to catch early on in the beginning. But if people don't really know that the potential for these diseases circulating is there, then there's a problem, because then there will be more and more cases transmitted or cases established in certain locations. So it kind of, I think it's a little bit of a pyramid where you start at the bottom with education and acknowledgement that these diseases are there, and then try and put more effort and more finances. I know that's, the golden goal for everything, but try and put the resources into those specific parts of the pyramid.
Joy, were you going to unmute yourself?
Yes. So I also think I remember when I was discussing with Dr. Doggett, one of our keynote speakers, she actually has multiple sclerosis, which is an autoimmune condition that's easily impacted by heat. So for many people with chronic medical conditions that are impacted by heat, so multiple sclerosis, sickle cell is another one. Um, People with these chronic medical conditions, as the weather warms and it becomes hotter, they're going to be able to leave their homes even less, or will actually maybe have to migrate away from places like Texas and other parts of the US that are getting increasingly warm.
Yeah, those are definitely that's very good points and very good points from the others as well. I do see another question in the chat here from Sam. If is there? Oh, go ahead, Sam. You got to mute yourself and ask.
I just wanted to let all of our audience members know and our panelists know we are being respectful of your time as we approach the 1 p.m. deadline. So if you would just go ahead and fill out the attendance form and the evaluation form, and we're going to hang out and answer this final question, which is mine, and then we will let you guys go to your other afternoon obligations. But my question was, is there any research looking at the impact of healthcare institutions on, say, a carbon footprint or emissions, or even what the impact of medical waste is?
Yeah, so this is fresh on my mind because one of our events for the environmental and sustainable health group was looking at healthcare sustainability. So I pulled up our slide set, and the healthcare's climate footprint globally is 4.6% of global net emissions. And then in the US health sector, it's 8.9% of greenhouse gas emissions. And if the US health sector were a nation itself, it would rank 13th in the world for greenhouse gas emissions in 2013. So that's some of the research that we pulled together to look at that.
That's just
Yeah, that's a mind-boggling data point for sure. I wouldn't have never have guessed or expected that. Well, great question, Sam, to kind of close us out. And so I didn't know if you or Margaret wanted to take us home, or are we just want to remind everyone to fill out the evaluation link in the chat, and just thank everyone for joining us today. Thank once again to our guest speakers for very informative, fantastic presentations that will be available for a recording. I have got multiple emails already to view recordings for those who could not attend. So I'm very grateful for everyone's time and effort put toward this. And hopefully, this could lead to continued efforts to keep the conversation about climate change and health and medicine going in the future.